Georgia's COVID-19 vaccine rollout just got a lot more complicated, and it's leaving many residents scratching their heads. Here's the shocking truth. Major pharmacy chains like Walgreens and CVS are now requiring a prescription for eligible individuals to receive the vaccine in Georgia. But here's where it gets even more confusing. This new rule isn't universal. Let's break it down. Following the FDA's recent authorization of COVID-19 vaccines for individuals over 65 and those under 65 with specific underlying conditions, Georgia's vaccine distribution landscape has shifted dramatically. CVS, for instance, has mandated that residents in about a dozen states, including Georgia, must have a prescription to receive the vaccine. This move comes as the company awaits approval from the CDC Advisory Committee on the updated vaccine, according to a company spokesperson. Similarly, Walgreens' appointment system in Georgia requires eligibility verification, preventing those who don't meet the criteria from booking a slot. But this is the part most people miss. Not all pharmacies are following suit. When 11 Alive News checked the websites of other major chains like Kroger and Publix, no appointments were available in Atlanta. However, it remains unclear whether this is due to new prescription requirements or simply a lack of supply. Both chains have yet to respond to inquiries about their policies. Meanwhile, at least one independent pharmacy in Atlanta is consulting its legal team to determine if it can administer the vaccine without a prescription. Georgia's Department of Public Health, DPH, has clarified that its facilities will not require prescriptions as they operate under separate protocols. Interestingly, even individuals who don't meet the FDA's age or underlying condition criteria can still receive the vaccine at DPH facilities, provided they consult with public health staff and have no contraindications. And this is where it gets controversial. DPH Communications Director Nancy Needham-Shyrick emphasized that the prescription requirement doesn't apply to DPH, hospitals, or physicians, as they operate under different legal authority than pharmacists administering COVID-19 vaccines. Experts like Dr. Jody Guest, a professor at Emory University's Rollins School of Public Health, warned that these new guidelines could exacerbate Georgia's already low COVID-19 vaccination rates. It's going to make it harder for those who want access to the vaccine, she said. Dr. Cecil Bennett, medical director at Noonan Family Medicine Associates, echoed the sentiment, noting widespread confusion among both providers and patients. While he plans to offer the vaccine at his practice, he remains uncertain about supply levels and patient enthusiasm. Here's a deeper dive into what DPH has shared about vaccine availability. The updated COVID-19 vaccines are not yet available. The FDA-approved vaccines are expected to ship by mid-September. Health departments place warnings based on need, with some districts pre-ordering and others ordering as required. Vaccinations at public health departments are administered by nurses following DPH protocols, without requiring a prescription. The cost of the updated vaccine for uninsured individuals remains unknown, though last year it was around $180. DPH is still awaiting CDC guidance on vaccine distribution through programs like VFC and the 317 program. As of September 2nd, this is the current state of affairs, but it could change with new federal guidance. Now, here's a thought-provoking question for you. Are prescription requirements for COVID-19 vaccines a necessary safeguard or an unnecessary barrier to public health? Share your thoughts in the comments. We want to hear from you.